After you finish your pharmacy degree, you go through a system called Oriel and you rank places to work. So this was my first choice place to work. I picked it because I like the description. It sounded like it had a lot of variety. You go through mental health, oncology, medicines information, dispensary and manufacturing rotations within this trust.
So I've lived in Gloucestershire for 3 years now and was brought down here for my pre-registration place. I live in Cheltenham and I really enjoy living in this area. I feel like there's quite a bit to do for a young person in the area. There's lots of food places, lots of eating places. I just think it's got a nice feel. Cheltenham's a festival town as well, so there's always sort of something going on.
I enjoy working in the department, mainly for the team and the people that work here. There's a very strong training and education element to the department. We've got a very experienced education and training team, but not just that, we have a large number of staff that are experienced specialists and get involved with supervising, mentoring. So coming to work here means you'll be very well supported.
The opportunities that I've been given here, one of them is to be able to study for an MSc in genomics, medical genomics, and that's really the future of healthcare and of medicine essentially. And I've been, I get time to go and study, and I'm also given time during work to complete some of the coursework.
I joined the Trust in 2017 as a pre-registration pharmacist, which is a 1-year course in order to become a fully qualified pharmacist. And then I've worked for the Trust ever since in a variety of roles. The department's been incredibly supportive for my progression in education, so I've had opportunities to do a clinical diploma across 2 years and also the independent prescribing course which I completed last year.
We've been at the forefront of digital medicine, so we've been putting in electronic prescribing, which happened last year. In 2 previous years, we put in new pharmacy robots and a new pharmacy system, an electronic system. So that's been really exciting. Pharmacists have been developed, so we've got non-medical prescribing pharmacists. It's been really exciting.
Everyone's been so friendly and welcoming. I feel like I've made really good friends with people in work. There's been a lot of support as well. There's always someone I can contact if I want help.
Personally, I've had 5 different jobs in the organisation. I've worked my way up from a pre-reg. We're always looking to develop new roles, so there's tons of opportunity for progression and the chance to get involved in new projects.
Living in Gloucestershire is great. You're surrounded by beautiful countryside. You're not far from London, you're not far from Devon and Cornwall. Bristol, just down the road, and Birmingham is not far either. And also Wales is really close as well. And also Gloucestershire itself, we're in the Cotswolds, it's a beautiful place to live.
I do enjoy my job. I think I work within a really good group of people. I think I feel supported professionally, and I do, enjoy coming to work.
I love my job as a pharmacist in Gloucestershire. It really does challenge me, but that's enabled me to progress and really improve my skills. I also like the fact that the role is so diverse and I have points of the week where I have direct patient-facing contact, but then I also am able to work on other projects and strategy back within the pharmacy department.
Schools are so good here for our children. Beautiful countryside, and we'd lived in the southeast before, and it's just so much more relaxing here, and that's one of the main reasons that we came here.
We nurture talent where we can, and we look after the people that come to us.
I've had such a good time here, and I feel like I've learned a lot in this year.
We're a great team. It's a lovely place to work and live. We've got a great balance between sort of town, city and country life.
So hugely exciting in terms of the amount of investment that's coming into pharmacy here.